Thank you so much, Dr. Saima. It's a real pleasure to be here. Welcome. And maybe just let me start by thanking the organizers, the International AIDS Conference, Zindagi, Aga Khan. It's a real pleasure. And I really hope that there's more of these learning events. I think this is exactly the kind of forum we need where we can really have technical discussions on such an important topic as HIV. So that last presentation was so inspiring. I have to say, it feels like we're really looking at where we hope to be in Pakistan in the near future on PrEP. And I feel like this is more like explaining kind of the beginning of a race where we're at in Pakistan. But so we are very much still in, I guess you could say, a rollout phase of PrEP in Pakistan. And if there's one thing I learned, so I'm working at UNDP as the program coordinator for UNDP, which is implementing in coordination, and Dr. Rasia talked a lot about this, that this has really been very much a team effort in Pakistan on the HIV response with the technical partners, community-based organizations, and then obviously the provincial and national governments. And everybody has really played a part in starting with this PrEP rollout. But I think, as I said, we're really at the beginning. It's taken quite a bit. I think in 2021 was when we started to look at the implementation plan, and that was from the national government that started with the PrEP implementation plan, the SOPs, and then all of the starting to put kind of guidance in place and national strategies around PrEP. This is still a work in progress, and I'll explain why. But maybe just to also situate this in the broader context of the prevention program in Pakistan. So Zindagi, the organizer of this conference, has been, and Malika could correct me, but they've been providing prevention programs for people who use or people who inject drugs for, I wouldn't say, at least 20 years in Pakistan. And so really a forerunner in Pakistan on prevention programs, which is important because PWID are the population, and people who use drugs are by far the most affected key population in Pakistan with HIV. The prevention program, the broader prevention program for other key populations, and Dr. Saima already spoke how Pakistan is still very much focused on a key population approach around prevention. It started in, I want to say, 2018. Yeah, something like that. So it's still, even prevention program in Pakistan writ large is fairly new in the sense. So in 2021 was when the guidance was started to put in place. And then we started to see, you can see there was a pilot sensitization workshop around PrEP. And you heard in the prior presentation that there's often a lot of pushback around PrEP. I think one of the things you hear in other countries is that it promotes risky sexual behavior, or promotes kind of behavior that's not appropriate in the context. So that was one of the first things to do, was to bring key stakeholders around what is PrEP, why is it important, what is the evidence base around PrEP. And then you saw that in March 2022, based on the SOPs that were developed with WHO, with the national government, and other technical partners, there was a training of physicians on PrEP. And now in July 2022 was the first time that PrEP was available in Pakistan. In Sindh was the first province to launch it, and it's only available through the ART centers. So maybe to situate this in the broader context around services in Pakistan, in 2022 and 2023, Pakistan expanded significantly the number of ART centers. So now there are 86 ART centers. I think when I arrived in Pakistan, there was about 50 or 52, I want to say. So there's been a significant expansion in ART centers in Pakistan. And then in 2023, UNDP and the provinces expanded the number of prevention services from 16 prevention sites to 53. So that was last year. So there has been a more than 200% increase in 1 year of the number of prevention sites available in Pakistan. So I think that's helpful to know, because right now in Pakistan you can only access PrEP through ART centers. Let me see. So we're really just starting to understand the data around PrEP. Actually, I can't really see even these numbers. It's just very far from me. I hope you can see the numbers. I can't. But basically, we're looking at, yeah, this is very hard because I can't see. So in Punjab, you're seeing that we've succeeded in enrolling more MSM on PrEP, whereas you see that in Sindh, we've succeeded in enrolling more sex workers and transgender communities in PrEP. And right now, the total numbers, right now in Pakistan, we have about 1,328 people who have initiated or enrolled in PrEP total. I'm sorry, in Sindh. And then you could see in Punjab, we're looking at a total enrollment of 1,504. We still don't have the data about attrition, and what I've understood is that there's a big attrition. So we're kind of like ARVs. We're succeeding in enrolling. I mean, you can see, even in 1 year, the numbers are actually somewhat comparable to Malaysia, which has been implementing PrEP a long time in terms of enrollment. But we're seeing a similar trend with PrEP that we're seeing, that we know has existed for a long time with ARVs in Pakistan, which is we're good at reaching out and getting people to initiate. We're not good at keeping people, supporting people to stay on PrEP. And so this is the issue that we're facing right now. So the model of PrEP. Right now, I hesitate to say we have a model of PrEP in Pakistan because it's an evolving discussion. It's a very active and live discussion. There are some people from the communities that are sitting in the room, and I have to say, I really want to applaud them because they have really kept a focus on what's going to be successful in PrEP. Even before PrEP was initiated in Pakistan, they were saying for PrEP to be successful, it's going to have to be delivered by communities. And this is essentially a year into the implementation of PrEP in Pakistan. This is exactly what we're seeing, that we are getting people, there is a huge demand for PrEP. We know that. Communities have been asking for PrEP to be available in Pakistan for a long time. So it's not an issue of demand. I mean, we do have to do much more demand generation and linkage to service, but there is a demand for PrEP in Pakistan. But it is about how we can actually get PrEP into the hands of people in a way that they feel safe and supported. So what's exciting is that actually, as you can see, the planned rollout in Sindh is, oh, thank you. The planned rollout for PrEP in Sindh is actually next week. So, I mean, this has been, I want to congratulate everybody that's been involved in this. So when I say the planned rollout for PrEP, I mean the community-based rollout. So since last year, it's been available in ART centers, and I showed you the numbers. You know, we have over 1,000 people enrolled. Next week is the basically the first time that we'll be initiating community-based PrEP delivery in Pakistan. And it's happening in Sindh in collaboration, very much in collaboration with the government. And I really want to thank the UNDP team. Dr. Rob Nawaz, he'll be on the panel, the next panel, who has been really working very closely with the CBOs in Sindh, with the provincial government and UNDP to look at what the model, what this could look like. So you can see there the service delivery points. There will be 17 in 5 project districts. That the projects meaning that what UNDP is modeling. We have also the SOP available. So the SOP was just finalized on Friday. So I don't even have time to create slides to kind of articulate what the SOP is. It's not even up on the website yet. But there is a finalized SOP that was agreed with the government and all the technical partners. WHO and UNAIDS have been hugely supportive. Aga Khan, I'm looking at Dr. Faisal, has been instrumental in getting this done. So the rationale for the PrEP transition. So why, after 1 year of implementation are we really pushing to change the model from an ART center model to community-based? So the key populations do not prefer to see physicians at the ART centers. It's not about the physicians necessarily. It's about the actual getting to the ART center, having to go to a center that you know is for HIV treatment, for a prevention commodity that should be relatively easy to avail. There is PrEP clients visiting ART centers are assumed by social HIV positive. There's a fear of social exclusion, perceived and experienced stigma, increase the acceptance. So I mean, this is all in the prior presentation. It's basically the same issues around stigma and discrimination. And I would also say just about the availability and the access of services. So as I mentioned, there's a huge expansion, and I really congratulate the government for such a huge expansion of the ART centers in 2 years in Pakistan. It's like a 30% expansion. So it does help. But Pakistan's a really big country. Many people live very far from ART centers, right? So asking people, even every 3 months, to get to an ART center, to get the prevention commodity is very difficult. So one of the things that's exciting about the expansion, this community-based model in Sindh, is that obviously, and the prior presenter, she really walked through a lot of the technical issues on how you initiate PrEP and what's required, right? It's the same, obviously, it's the same in Pakistan. And so you need to go through the testing, the baseline testing, and all of this needs to be tracked, and we need to be keeping data of people on PrEP. So of course, the initiation has to be in close collaboration with the ART centers and managed by the ART centers. But then once you have people initiated and stable on PrEP, we're looking towards this model to show us how we can make it more accessible for everyone. The challenges so far, I think I already spoke to a lot of this, also low literacy rates, lack of awareness. So the other thing to mention is that you do need to, as the prior presenter mentioned, you do need to do regular HIV testing when you're on PrEP. One of the exciting innovations, it's really not an innovation, but an evolution in Pakistan is also last year we introduced HIV self-testing. So this is something that can help with PrEP adherence, that people can actually now avail themselves of HIV self-testing. So here's a bit of the timeline for the transition, and as I mentioned, we're literally in the last stages of this rollout to community-based PrEP. This is when I'm talking about Sindh. So let me talk about Punjab for a little bit. So Punjab is taking a very different model right now. They're also in discussions about what this looks like. They know what's happening in Sindh, and I have to say it's been a very open dialogue. What Punjab is recognizing the issues of the barriers that communities have faced in accessing PrEP in the ART centers. They have set up a center in Lahore that's actually based at the AIDS Control Center, and they have trained staff to be available to disseminate PrEP at this one center. And so they're launching this. I don't know if they've launched it this month or next month, but this is going to happen, and so they will be following what happens with this model. I suspect the model will work for some people, particularly people that are based in Lahore, but I suspect that you'll still see the challenges that people that aren't based in Lahore. Punjab is a big province. Punjab has over 65% of the burden of people living with HIV, and it has, I think I want to say it's similar in terms of new infection rates. So Punjab is the province with the bulk of the HIV response requirements in Pakistan. And so one center for PrEP, we'll see how it works, but I mean, the government has been very collaborative in the sense of trying to understand the problem and trying to come up with solutions. And we're following both of these models, which are now being implemented, and we'll see kind of what that means in terms of the numbers for Pakistan. But I mean, I think that's it in terms of slides, but I think I really wanted to maybe end on one note, which is I feel like one of the biggest challenges in Pakistan has been to see the policies and the implementation align. And so I mentioned, we did about 2 months ago, my team held some consultations with community members about the evolution of the program, the HIV response in Pakistan. And so we did one with different consultations with 3 different key populations. And one of the biggest messages coming out of that consultation was that people want PrEP. People know that PrEP is, and it was said that in terms of a game changer for Pakistan, you have 2 things that are new in Pakistan, OAMT and PrEP. And that we have now the policies in place. We have, I think, universally across the response in Pakistan, at least people that are involved in the HIV response, there's no one that's saying PrEP isn't the game changer that we need, and there's no one advocating against PrEP. I think where we're at right now is we have 2 models that are being rolled out. There's also large swaths of Pakistan that don't have yet a community-based model or a PrEP delivery, right? And so I think there's a long way to go in Pakistan. I really was inspired by the last presentation, because you can see, I think, where we can get to in terms of a community-based model, and also the types of data that we should be tracking on PrEP and where we need to get to. And so I really hope that, you know, when somebody comes, if the International AIDS Conference comes back here next year, I really hope the presentation that somebody will be giving will be a community organization talking about the work that they've done to deliver PrEP to their communities, because I really think that will be the game changer, and that we're at the cusp of that. Next week we will see community-based delivery for PrEP in Pakistan for the first time, and that there will be a huge amount of learning to happen. And so again, let me end with saying that, again, I really thank the organizers who put this together, because I really feel like these are exactly the types of forums and discussions that we need to be having, so we can be in a collaborative and learning and evidence-based way, understanding how we can really make a change and see a change for the communities most at risk to HIV in Pakistan. So thank you so much.